Hi there, I'm Dr. Alessia Roehnelt. I'm a double board certified endocrinologist, and I want to explain more about how GLP-1 medications actually work. There's a lot of misconceptions out there about what they do. I've had some patients come in to say to me, well, I don't eat that much in general. Is it even going to work for me? Or my appetite is already suppressed. How am I going to lose weight from this? So I want to kind of clear up how they work, what they do, and who might be a good candidate for something like this. So GLP-1 medications stand for glucagon-like peptide 1. And these are medications that bind to this GLP-1 receptor in the body. When you initially start taking one, what somebody might notice first is some stomach side effects. That's because these medications slow the amount of time it takes the stomach to empty, which means you feel fuller longer, you get fuller faster, and you're able to digest food a little bit slower, which can help kind of slow down a spike in blood sugar and a spike in insulin. However, slowing down gastric emptying can sometimes cause side effects such as heartburn or nausea or burping. Some of my patients describe these like sulfur burps they might get on medication, because it is affecting the speed at which your stomach empties. Another way that these medications work is they play with receptors in the brain, appetite receptors. And so they do work on that concept of food noise. If you're unfamiliar with this concept, this is the idea that there's always the thought of food in the background. Even like while you're eating your current meal, you're thinking about what you're having for your next meal. A lot of my patients have said that they've had this feeling their entire life. They knew no different. But when they start taking GLP-1 medications, not only does the appetite suppress, but that noise goes away. That constant thought about food starts to go away. And a lot of my patients have said this is the first time in their lives they've ever felt like this. They didn't know that it was normal to not always be thinking about food. They thought it was normal to always be thinking about food in the background. So they work on the stomach, they play with hormones of appetite, and they have a lot of other functions throughout the body. The longer we're using these medicines, we're finding out more and more. So for instance, there was a study a few months ago that came out that showed semaglutide, which is the active ingredient in Ozempic and Wegovy, actually reduces pain from arthritis by up to 70%. Other patients have found that these medications have anti-inflammatory effects to them. And when they take these medicines, they have less joint pain or they feel less swollen, less bloated. These medications, a lot of them are also approved to reduce the risk of cardiovascular events, things like heart attack and stroke. And that's because these medicines have been found to significantly reduce the risk of things such as a heart attack or a stroke. These medications, some of them also help to treat or reverse fatty liver. So some of them have indications to treat fatty liver. One medication in particular, Tirzepatide, which is also known as Zepbound, has an indication to treat sleep apnea. And they found that independent of the weight loss, this medicine helps for sleep apnea. Particularly, it's approved for moderate to severe sleep apnea. So the longer these medicines are out, the more we're finding out about them. Some of the newer data is actually suggesting a link between GLP-1 use and less cancer spread in certain types of cancer, such as breast. That is new emerging data. These are not randomized controlled trials. They're more observational studies. But it's very interesting to think that these might even potentially help reduce the risk of cancer spreading. So there are many options to choose from with GLP-1s. You want to think about it breaking down into, are you using this for weight loss or are you using it for something else? So if you're using this medicine for weight loss, the main ones on the market right now, injectable medicines, are Wegovy, which is the same thing as semaglutide or Ozempic. Wegovy is a GLP-1 agonist, meaning it binds to that GLP-1 receptor, one receptor. Wegovy is one of the first medications that came out for weight loss. That's a weekly injection, and it is approved for just straight up weight loss, depending on your BMI. Another very popular injection, though, is Zepbound or Tirzepatide. That medication binds to two receptors, GLP-1 and GIP. By binding to both of these receptors, this medication in studies does seem to give a little bit more weight loss. And interestingly, even though it seems to be a little more effective for weight loss, many of my patients tend to have less stomach side effects on this medication. Now, soon we are going to have a third type of medication that is going to target three receptors. That one is going to be the generic of it, or the ingredient is going to be called retatrutide, but we don't know what the brand will be marketed as yet. But that medication will be targeting three different receptors. And in studies so far, it shows to have the most weight loss we've ever seen in a medication before. There are also some pill versions of Wegovy available, as well as a new one called Foundayo, and that is by the same company that makes Zepbound. These pills are newer, but they are daily medications that do also help with weight loss. They seem to be maybe a little bit less effective for weight loss than the injections, but for some people, they really are a perfect fit. Now, if you're using a GLP-1 for other reasons, for instance, for type 2 diabetes, they do help control blood sugar quite significantly. They are some of the most powerful medications we have to control blood sugar. So if you're using it for diabetes, you are generally using the brands Ozempic, which is your GLP-1 or Semaglutide, or you're using Mounjaro, which is your GLP-1/GIP, and that is Tirzepatide. Those are the two main injections available to treat diabetes. There are others. There's one called Trulicity. There's one called Victoza. There are other medications like this. But the ones that really became very popular, that got a lot of publicity because of the significant weight loss, are the two I mentioned, Ozempic and Mounjaro. Now, other than obesity and type 2 diabetes, there are some other indications for these drugs. So I mentioned before, Zepbound has been approved to treat sleep apnea. So if you have a diagnosis of if you have a diagnosis of moderate to severe sleep apnea, you might potentially be a candidate for Zepbound without being overweight. Or if you have signs of fatty liver, that would be an indication for a medication called Wegovy or Semaglutide. If you've had a previous heart attack, you're very high risk for heart disease, you have very bad peripheral arterial disease, those are FDA approvals for Wegovy or Semaglutide. So because these medications have just been shown to be so helpful in so many different conditions, we no longer think of them as weight loss drugs. They really are metabolic drugs. They target a lot of different metabolic disorders. If you found this helpful, please subscribe. I will be posting content weekly on medical issues that you might be concerned about, hormones, weight loss, metabolism, all of it. So like and subscribe.